Okay, so femto. What is the purpose of any new cataract surgical technique or surgical technique in general? Is make complication less. And when we think about cataract surgery, what we look at is the rate of posterior capsular tear, which as an average is around 1.5%. So the femtosecond laser, what does it do for us? Corneal incision and arcuate keratotomies, capsulotomy and lens fragmentation. We do use it at Moorfields, but I have to say that most of us are abandoning it. Why? Because if you look at all the published peer-reviewed literature, at the moment, flux has not demonstrated a superiority versus manual surgery. And there has been especially one of the papers that has been done by one of my colleagues looking at Cochrane review, looking at all systematic reviews of randomized controlled clinical trial and outcomes of those, flux versus manual surgery, looking at all the things that really count, anterior and posterior tear, visual acuity, refractive outcome, and other outcomes. And to cut a long story short, the conclusion was that there was no difference whatsoever in terms of anterior tear and posterior capsular tear in all the randomized clinical trial. There was no difference in terms of unaided and corrected distance visual acuity. Perhaps there is a little bit of a difference in the rate of endothelial cell loss, which you probably would expect because the lens is already cut by the femto laser and sometimes is fragmented. If this matters in clinical practice, we don't know. So at the moment, we still need more randomized clinical trial to demonstrate if the femtosecond laser is actually a marketing tool or if it works. And I think it's probably still the future, but we are far from it at the present. We did an interesting study when I was the main surgeon comparing flux surgery with manual and looking at the speed and intraocular movement with a complicated video recording system. And ultimately, what we realized that the reason why flux surgery takes longer is the IA, because the SLM is a bit stickier and therefore takes a little bit longer. So there is no advantage even when you start from having already a rhexis and a split nucleus. And ultimately, if you can perfect your capsular rhexis, probably is not going to be super useful. So as you can see, once that you perfect your technique, there is not much of a difference between a manual and the femto-assisted capsulorhexis. For those, here we go. That's just this was a few years ago because at the moment, like I said, I have abandoned the flux completely. I think Bruce has done the same. But this just shows you the way that the laser works, which is beautiful, but adds time onto the surgery, is expensive, and if studies, including randomized clinical trial, are not showing that there is a real benefit, as a surgeon and doctors, we have to question ourselves why should be using it at the present. So it's really quick, effective, but doesn't add any benefit. So here we're doing also the incision. And one issue with the femtosecond laser is also that sometimes, unless you pre-treat the patient with lots of anti-inflammatory drops, it's very easy to get poor pupil dilatation intraoperatively. So I'm glad to say that like me, Miltos, Bruce, and most of us, despite phaco-cataract surgery being older now than 50 years old, is still going very, very strong. And I think at the moment is still the mainstream and the best evidence supports that is the most advanced surgery. Thank you.
Want to continue or want Bruce to do?
If you want, I can just talk about hard and soft cataract.
Go ahead.
If you guys can bear with me, then I...